Hi, my name is Susie. I'm a lab tech at Lake Cumberland Regional Hospital. I usually work in micro, so my case study is over a stool culture I performed back in September, and it came out to be Salmonella oranienburg. So we are going to start with the patient. Patient is a 14-year-old female brought to the emergency room with diarrhea and dehydration. While she was in the ER, they performed a CMP and a CBC. Everything was normal. They went ahead and admitted her to the pediatric floor because of the dehydration. Once she was admitted, they collected a stool sample and we done a C. diff screen first. It was negative. Once that came back, they added on other screens and a culture. The CAMPI antigen was negative. Shiga toxin was negative. The stool white blood cell screen was positive, which you can have white blood cells in your stool with intestinal inflammation or infection. So at 24 hours, we read her stool culture, and the blood agar plate had normal stool flora, large gram-negative rods, nothing indicative of an infection from there. Her McConkey plate had moderate clear colonies and a few pink colonies. The moderate clear colonies caught my eye, non-lactose fermenter. Then on the XLD, we had moderate black colonies and a few yellow colonies. Yellow is normal flora. The black colonies, that is a hydrogen sulfide producer. So that is also not normal flora and indicates a pathogen. And then the sorbitol with McConkey, it was pink colony, so there was no E. coli 0157. But with the non-lactose fermenter and the black colonies from hydrogen sulfide production, I was starting to think there might be some salmonella in this stool culture, so we need to work it up. So this is what the McConkey plate looked like: clear colonies, XLD black colonies from the hydrogen sulfide. So the black colonies from the XLD plate was used to set up a gram-negative panel on the microscan walkaway, which is what we use to ID and get a sensitivity for bacteria. Organism ID came out the next day as Salmonella, and the sensitivity, everything was okay. It was sensitive to ampicillin, ciprofloxacin, and trimetsulfa drugs, which is all we report out for Salmonella. So since it is Salmonella, that is reportable to the local health department. And we also have to send an isolate to the state lab for species identification. That came back a few weeks later as Salmonella oranienburg, and it is a group C1 Salmonella. They speciate it by doing serotyping, and that includes like the O and H antigens on the cell bacteria surface. So with a salmonella infection in general, causes come from raw meat, poultry, and seafood, raw eggs, or unwashed or uncooked fruits and vegetables. Symptoms can include nausea, vomiting, abdominal cramps, diarrhea, fever, chills, headache, bloody stool. But if it's a really light infection, you might not have any symptoms at all. Now, to diagnose a salmonella infection, most common is probably how we done this Salmonella here, a stool sample for culture, but it can also be found in blood, tissue, or urine specimens. Treatment for dehydration, you're going to be given fluids like this patient was. If it is a very heavy infection, you're going to be given antibiotics to kill the bacteria. And then antidiarrheals will help with the symptoms of the infection. And then if you're asymptomatic or have a really light case, you may not need any treatment at all, and it'll kind of pass on its own. So when I started researching Salmonella oranienburg, because it was a species of Salmonella I had never heard of, I actually found that there's a current outbreak right now. So on October 20th, 2021, ProSource Produce and Keeler Family Farms recalled raw red, white, and yellow onions from Chihuahua, Mexico. And since then, even more companies have recalled onions from the same area. So as of November 14th, there have been a total of 808 illnesses, 157 hospitalizations, no deaths so far, and it is almost nationwide in 37 states plus Puerto Rico. And I'm sure these numbers will continue to go up as more cases are found. This map here shows the distribution of cases so far. As you can see, it is heavily concentrated in Texas, which would make sense. It is the closest to the source of the onions. In Kentucky, there have only been 9 cases so far. And for my research, I used a lot of information from the CDC and FDA. They have current investigations going on into this outbreak, so they have a lot of good information, and it continues to update. And that is my case study on Salmonella oranienburg.